Oh, I think we've come a long way with the TKIs, but there are still a lot more unmet needs and challenges. I think the major challenge we're looking at the advanced SM group is that the patients that have pure ASM, they're a small proportion, and it really is looking at this group that have two hematological neoplasms that coexist, the AHN and the SM. And I think looking at the mutational profile, looking at which disease evolves first, which is causing the symptoms, is going to be the main challenge, because then ideally, if we want to get some sort of complete remission for both, some control or cure for both, we need to define what we mean by cure. Do we mean a pathological or a molecular remission? Do we mean complete resolution of the disease? Do we mean curative intent with a bone marrow transplant? So I think there's challenges about whether we use doublets or triplets of treatment modules or therapies available for these patients with the AHN. And again, the prognostic scores for both these diseases which live in a particular patient are different. So just learning a little bit more about the AHN group and knowing where to target the treatment is really, really important. And I think the ways of doing that are at the moment looking at the single cell culture, looking at the mutational profiles, and also I think really importantly for the trials now that we've had a pure pathological response demonstrated with avapritinib, I think it's what Jason talked about is moving the paradigm and maybe looking at our symptom evaluation within trials and changing it, looking at a pure pathological response, and there are 4-tier responses to make it clinically meaningful. So still a long way to go. We've come a long way so far, but lots of challenges that we need to still think about.